This is Uncommonly Remarkable, where we discuss the surprising everyday lives and notable accomplishments of community leaders, entrepreneurs, and everyday folks like you and me. My name is Artis Beatty. I am a doctor of optometry and the chief medical officer for My Eye Doctor OD. Though we will inevitably touch on topics within my area of expertise, the opinions and the conversations held here are separate from my work with my eye doctor. Well, hello, and welcome to another episode of Uncommonly Remarkable. Today's guest describes herself as a resourceful, competitive maximizer who is also a witty, creative thinker and problem solver. She is CEO for Alliance for a Healthier Generation, a leading national public health nonprofit that is focused on systems change in schools as well as out of school time to create healthy environments where children and the loving, caring adults in their lives can strive. She's humble beyond measure, so friendly and very approachable. And even though she's busy beyond belief, she decided to come and sit with us today and have this conversation. So, ladies, gentlemen, all of you remarkable people, please welcome Kathy Higgins to the show.
Artis, thank you so much. Great to be with you.
This is so exciting. I actually cannot believe I got you to come over and talk with me because I see you going back and forth, and I know that you're busy. You've got the boys, you're doing all these things. And we were planning on sitting down and talking, and schedules kind of changed. And then you went through a move and all these things. And then I actually got back some of the information you sent me about yourself. And I was like, oh my God, where does she find any time at all? And so I'm very honored that you decided to spend some time with us today.
Well, that feeling's mutual, so thank you.
We have so much to talk about, and I am thinking about where we're going to start. And maybe it's best to start talking a little bit about what it is that you do today as a CEO and Alliance for a Healthier Generation. Because I spent some time tooling around on the website and learning a little bit more about the organization, and I found it fairly fascinating. And it's interesting from my perspective because I did not realize that an organization like yours really existed. And then I started thinking about, well, gosh, it's really a necessity given where we are. So can we talk a little bit about that?
Sure, we can. Maybe what I'll do is I'll just start with a little bit of background in terms of my career, but just high-level details in terms of got out of undergraduate school, was a teacher in private school and then a teacher in public school, and also coached my former field hockey team or the field hockey team at my former high school in Cherry Hill, New Jersey. Went to graduate school and then had a chance to come to North Carolina. And I had this vision of being in this state, but I don't know why. It just like how I captured that was to say, if you had a former life, I was born here.
Wow.
And so I was drawn here for no reason at all other than this is where I wanted to be. What it led to is just a career in philanthropy, working in corporate philanthropy, aligning corporate strategy with community engagement and impact. But this job the last 5 years, being a CEO of a national nonprofit focused on children's health, allowed me to move to the other side of the table and learn things that prior to taking the job, I couldn't even imagine that I would grow so much professionally, almost sort of like at the more mature end of my career. And so that has been so significant. And the history, if I could share about the Alliance for a Healthier Generation, is really sort of special and maybe even unique. And it holds this very special place in the nonprofit community on a national scale. And that is, we started because President Clinton had suffered a heart attack and quadruple bypass surgery and was thinking about the healthy aspects of his lifestyle changes that needed to occur after those traumatic events. And it was the leadership of the American Heart Association, the CEO Nancy Brown, and President Clinton, and some other important and very key people that came together to think about what could we do to make a difference. And the simple term is that what they didn't want to do is just a PSA. Mm-hmm. You know, they didn't want to just use the president's voice on health changes in sort of a commercial sort of way. And
I
at that
see.
same time, childhood obesity was identified as an epidemic in our country and moved almost from the back pages to the front pages. Like, this is a problem. And so they came together and launched the Alliance for a Healthier Generation. The whole notion of these two entities coming together in alliance, but also the fact that as a public health organization, we too should work in partnership. And so we like to say that Alliance is our first name, that we work together in a big table, all are welcome. And so we also had this perspective of equity early in our forming as an organization.
That is interesting to hear, because there have been other administrations that have looked for ways to help to make sure that children were well taken care of or healthy. So I remember growing up, as an example, we had the fitness testing during the Reagan
President's Council on Physical Fitness and Health. Yes.
That's right.
Yes.
That's right. And so, you had to perform a certain number of physical tests during this period of time, and it was a way for people to build awareness and understand that it was healthy for children to also be physically fit and assess where that fitness was. But that's different than what we're talking about here, in that I don't know that it had the same level of acceptance, or maybe the same level of enthusiasm as what I'm gleaning about where you are.
That's a great thing to unpack. The President's Award for Health and Fitness was a recognition program that did motivate you to do those things to achieve that certificate or that patch, or I forget what other aspects of the awards program was. But I am a big believer that recognition, and it's research-based, that will drive behavior change. So when we go back, that award, to your point, that award existed decades and decades ago, and was a really neat way to be in schools and to promote physical education, physical activity to our children, and to work to motivate them. But what we know is that so many changes occurred over time. The busyness of families, the economics of households, the access to healthy foods, or the ease and access of unhealthy foods to folks, the sugary drinks in schools as a fundraising model for schools to actually have money to support some of their activities. So the other key part of President Clinton and the Heart Association coming together, the third leg to the stool, was the Robert Wood Johnson Foundation, really not only providing the financial resources, but bringing their greatest minds to the table and thinking about, from a strategic standpoint, what would a leading national public health organization look like? And what does it need from an operations standpoint to operate nationally but deliver the work locally?
Yeah.
And so they, along with all the other entities, had that vision that we're an organization that was created that has a technology backbone unlike any others, that we invest in our marketing communications, and we really follow commercial best practices. So not unlike any company that you would interface with, like, we use the same tools, the same resources, the same creative thinkers that you would find in the private sector. That we have measurement and evaluation. We care about what we do, and we want to make sure that our work is making a difference. Is anyone better off, is what I constantly ask every day to our employees, because reach is important.
Right.
It's important. And we have numbers of impressive reach, the number of schools we're in, the number of families we connect with, the number of school children we interact with. But is anyone better off is what really matters. And that's why we're a systems change organization. And the fourth piece or pillar in our organization is a subject matter expertise, that we have folks that know how to operate in evidence-based or evidence-informed work. And our model is a continuous improvement model. So we work with schools in policy and practice change. We help them with their wellness policies.
So that to me is key, right? So you said a couple things that I want to go back to.
Okay.
One of them we started with because it's not only the children, but the adults that care for the children.
Yes.
Can you talk a little bit about that?
Sure. So, and a couple of areas of our expertise in there has really blossomed in the last 5 or 6 years. And that's because of funding resources that we've received. And so we didn't have a formal way to communicate, let's say, with families or caregivers or parents. And because of Kohl's and their investment in our work, that allowed us to create really effective communication tools, easy to apply healthy cooking and recipes for families, stress relief opportunities, and quick bites. That's what families need. They need health to be broken down into seconds or minutes, not hours or days. And they need to be able to absorb resources that will help them when they need it most. And that's what we've been able to do with the investment of Kohl's now over a 6-year period and going into, we just have a renewal with them for 3 more years. And so that has allowed us to reach families. The other piece that we were able to do so effectively, and especially when COVID hit, so we all know what we were doing on or around the week of March 15, 2020. Yeah. We were able to pivot immediately because what I hadn't mentioned is that as a national organization, we're virtual. So all our employees work where they live, live where they work. And so our ability, we'd been operating in a Zoom Teams environment since that existed, but we'd been virtual since we existed. And so we've just always been able to absorb, adapt, perfect the tools that are readily available for communication and connection. And so for us, we immediately started thinking about staff wellness. And if you think about COVID, schools were no longer 4 walls of learning.
Yeah.
What happened is they became the food pantry. They became the access to healthy foods and access to meals for families in the community. They became the public health epicenter in a community because they start partnering with health departments or for accessing their vaccinations, and they became an opportunity to communicate around stress reduction programs to families during this really confusing time for folks. So we immediately pivoted and focused on staff wellness, knowing the whole put your mask on in the airplane before applying it to your children in an emergency. And we just felt like we needed to reach the teachers, the administrators in schools and support their health and well-being so that they could be there for their community.
And I think I read that you're involved with 52,000 schools or so.
Yes. Yeah.
That's enormous.
Yes, it is.
And so how do you manage dealing with that volume of students, teachers, and parents when we're thinking about those 52,000 schools spread across the nation?
Sure. Yeah. One aspect of that number is that it's a cumulative number of who we have connected with, interacted with, worked with, or who proactively is reaching out to us and working with us. One of the innovative ideas of the folks that started our organization was this technology platform. So we're now about to celebrate our 20-year anniversary. So we're 19 years young as an organization. And if you think about going back 20 years and thinking about the importance of technology, and then the ability to access. So what is called our Action Center, all our resources serve on our Action Center. And so any school can sign on for free and access the tools and resources that they need. And same with families and parents and caregivers, and anyone who wants our resources can get that. So from an early perspective of equity,
Mm-hmm.
That was really important to those that started our organization, that our resources would be available to anyone who wanted them. The other piece to that 52,000 schools is that 70% of those schools are Title I schools. So that means that they, from a federal poverty level or free and reduced lunch measurement, that they have the highest need students that are attending their school. And so, we have a vision that we want to reach every Title I school and make sure that they are equipped to be as healthy as possible in their policy and practice change. So that's the other piece to it. Every school is federally mandated to have a wellness policy. What our work is to make those wellness policies with the school and with the data come alive and really focus on what are the things that they want to change most and work them through a continuous improvement process, business process engineering right there at the school level to improve policies so that they can create the environments for healthy children.
And that was going to be my next question, kind of thinking about policy and policy change. Can you give an example of an effective policy change that you might implement with the school?
So I'll can probably touch on a few, but one of the things that we do when we're working with schools is listen. We're in proximity then with them, and we want to know what are the things that are concerning them the most, and how is it impacting learning or attendance, or what is impacting the concern of families and parents. And so when we know where they want to start, it's just a great way for us to collaborate in a collaborative way on change. What we know is that many school systems might have policies in place that are really not favorable to children that come from low-resource families, or our brown and our Black children, and our children that are really from marginalized communities. And so often what they have is restrictive, really punitive policies that, and the example I'll give is on vaping and tobacco use.
Okay.
And so what we know is that the industries are marketing to these children.
Right.
They're marketing them. And when we know with vaping is it tastes like bubblegum or smells like blueberries, or it looks like a device that you wouldn't even know. You wouldn't even, as an adult, necessarily know what if it was it could be a pen. It could look like something that not like what you're used to looking at.
Totally innocent, right?
Totally innocent. It's an addictive product. And we really work with the schools to come up with restorative practices on how to deal with change. So instead of expelling children, let's just say as a process into dealing with a problem or an issue or something that was identified, we work with them to come up with different practices on how do they support that child? How do they get them into a program that will help them shift that addiction to more healthy living ways? And how do we not take children and remove them from school? Vaccinations is sort of another area. If you think about when we went through COVID, plenty of folks didn't know what well child visits were.
Right.
That's really sort of a privileged class of comment. And what we know is that children were being expelled or kept from school if they weren't up to date on all their vaccinations.
Yeah.
Well, they missed all those, and folks are working. They don't have access to maybe the easy access to the public health opportunities to have those. And we worked with schools, in fact, in North Carolina, in Bertie and Robertson County, work with schools to be then the convener of the providers in the community, the healthcare, public health folks, the folks that would provide the vaccines, and use the schools as almost that opening area where people could come together. We have 250 children in both those counties back in school that would have been kept because of a policy that says you're not allowed in here
Mhm.
if you don't. Instead, working with the school to say, wow, when that happens, here's what we do. We convene people, we work together.
That's a fantastic example. So there are a couple things in there. One is that you're absolutely right in that it's easy sometimes to take for granted that you have I call them well patient visits, but you have well visits, right? Because that is not necessarily the norm for the maybe even the majority of the population, right? And that you are going to seek healthcare when you have a problem that needs healthcare, not in anticipation of or preventive of,
That's
right?
right.
And so when we think about schools, there have been a lot of programs that have been designed around helping to bring some form of healthcare to the student from a preventive standpoint. But vaccines is one that I've never really thought about, which has a huge impact because you're when you're looking at records for your student base and they're missing things, um, I would never, I would not jump to the student can't come to school. But that's obviously not the way it works when there aren't ample resources to think about how do we work with this student if there's not policy around instead of the policy being to expel or to prevent the student from coming, this is what we do instead. And so that's amazing work to really be able to get with the school and try to help them think through that. You said that you listen, and how do you work with schools who maybe don't know what they don't know, though, right?
That's a great question. And one is that we are able, I mentioned another key asset of our organization is our measurement and evaluation and access to data. And
Okay.
so we're able to share community based data directly with the school or school based, and schools have a lot of data. So, another way that we can sit down and work with them is to look at the data and even help them identify actually, here are the top 3 factors or the top 5 factors that are impacting the health and well being of your school. And what we know is that healthy students perform better. They just, we have the research on that. And so we're able to, the reason why we're showing up is not only for healthy environments, but also academic achievement. And what we also want to do is make school a place where students are showing up. And absenteeism is a big deal. And it's a big issue. And so we want to make sure that, first off, kids are there and that they have full bellies worth of good food, that they feel supported, that they feel psychologically safe,
Mm-hmm.
that they're interacting with teachers that also feel that way, and that they are, living in a healthy environment to help them thrive.
And you said that you feel like you've gotten to see it from the other side of the
Mm.
table.
Mm-hmm.
And you had a long history
Mm.
with Blue Cross Blue Shield of North Carolina in various roles. How has this side of the table flip really happened for you? Can you talk a little bit about? It's hard to talk a little bit about a storied career because I've seen a lot of the work that you did with Blue Cross Blue Shield, but I'm just interested in how this feels different than the work that you were doing before.
It does. I've learned so much in both these incredible opportunities. To start with Blue Cross, is that one of the things that was always so impressive is with our executive leadership and thinking about community impact is not an appendage to the organization, but as part of the strategic focus of why we have the pleasure of serving and working in the state of North Carolina for the people of North Carolina. And so that's a pretty special perspective that you serve at the pleasure of the folks in the state that allow us to be there. And then, so when executive leaders make community impact, community corporate citizenship, a strategic part of their business model, it's at the table. It's not just outside of a nice thing to do. It's not public relations.
I see.
It's actually part of the strategic DNA of the organization, and it becomes sort of the heart and soul of the employees. When you think about employee engagement, working for a purposeful company, why do I do this work, and how do I feel a point of pride in the work that I do as any employee at Blue Cross North Carolina? The community part of it is significant. So the honor to work with CEOs that embrace that was significant, that they saw the value and benefit of being a leading corporate citizen, that they continued to invest year over year over year in the work that we did. And then the dream that I had is the ability to create a private foundation at Blue Cross so that our community resources that we were engaging, with the community, financially, that it wasn't dependent on business success.
Oh.
And that if we could create a foundation, we would always know what we were able to do. And the community could also count on it. It wasn't something that was tied back to the ups and downs of a normal business cycle.
What a phenomenal thought. I mean, that's because business trends tend to influence what businesses are willing to do outside of their doors, right?
Right.
So I've never, it's mind-blowing for me now because I've never thought about it that way, but being able to create a foundation that's independent of the business trend is an incredible thought. And so, wow.
Yeah. So I used to say, like, I knew exactly what I was wearing. I knew the weather that day. I knew what time that phone call came in. But when Bob Gretchen, the CEO at the time, called after the board meeting where they approved the creation of the foundation as well as the initial investment of $15 million. So that was July 25th. And by November 14th that year is when we launched the Blue Cross North Carolina Foundation. And that was in 2000. And so, they're about to celebrate their 25-year anniversary. They have a corpus is probably not the right word, but basically Blue Cross has been able to continue to make investments into the organization, and they're more than a $200 million foundation today. When after I left at the end of 2018, and really make work in community with community, we did philanthropy in a real thoughtful and considerate way. And we never considered ourselves just check writers, just putting money out there, but working with community. And so at least I had that foundationally going to the nonprofit side. But what a shift to have a career at really investing in community, writing the checks essentially, but really having those investments to go on the other side of the table. And I thought I knew so much, but I can tell you that I've learned so much. So to be fundraising and to raise $15 to $20 million a year, and our fiscal year starts July 1st, and I do tell the story, like, I swear I wake up on July 2nd going like, I'm so behind. But the principles are the same in terms of that you've got to do good work. You have to have a purpose. You have to be able to differentiate yourself from what the market needs and how you deliver it. And then you have to be able to be in relationship with people. Yeah. People have to trust you. And so I think we have an organization that is really effective at showing up as professionals, doing great work in a real thoughtful, collaborative way, but also building relationship with people.
Is there one thing that you can point to and say, if I had not done my work at Blue Cross Blue Shield, I would not be successful at Alliance for Healthier Generation.
Mm, that's a great question. I think because at Blue Cross, we took relationship building, so we made it such a priority.
Mm-hmm.
It was our DNA. And even though we were the funder, we talked about this all the time, and they probably still do, but recognizing the power dynamics. When you're the funder versus you're the person, the organization asking for the funds, even in relationship, there's a power dynamic.
Mm-hmm.
But the more we can address it, the more we can show up listening, again, as a funder,
Mm-hmm.
the more we can try to understand what resources that they need, the better. And so what I learned at Blue Cross that I've been able to take with me that is I understand, especially in corporate philanthropy and also foundation philanthropy, I understand that there's a set of goals that they are seeking to achieve. They have a strategic focus. They have a reputation focus, and understanding that and showing up first in those conversations
Mm-hmm.
by knowing that they're wired based on the impact they're seeking to achieve. And what I'm looking for is how does our mission align with the goals? Because if there's connectivity there, then we can speak about and we can think about, like, what are the creative ideas that we can combine together to make a difference.
One of the things that you mentioned that I think is worth pulling out again is the engagement of the people who are working towards the goal, right?
Absolutely. Yeah.
And I think that as I listen to you talk about it, and I kind of see how animated you are about like the work that you do, like I think that enthusiasm and the thought process rings with all of the people that work within the organization. This is a little point. I read it and it just was very interesting to me around the engagement piece, because often companies, organizations do engagement surveys. They want to understand where people are, and so there are several things that tell you how engaged your organization is. One of them is how many people actually participate in the actual survey, and then the second is what they tell you when they do.
Right.
And your organization has done engagement surveys, and my understanding is that everybody participated,
100%.
which is amazing, right?
Yeah.
But then you also did very well in how the organization felt about the work that they were doing, the overall engagement score.
Yes.
Were there things that you did as a CEO to help make sure that the organization remains aligned and engaged? Is it endemic in the culture? Like, how do you see that development? Because that's something that not a lot of organizations can say.
No, thank you for that question. And then we're also very proud of our Net Promoter Score, which a lot of nonprofits don't necessarily
Oh, that's true. Yeah.
measure. And it was something really important to me when I got there that we start measuring, and we achieve an excellent score. We're on track to go into market on that actually in the month of May, and we are at 59 right now, and that's considered excellent from a nonprofit rating perspective. So a couple of things. One is, when you choose to work in nonprofit, you immediately you say to yourself that you want to work for a purposeful organization or a mission-driven organization. So we do understand that. Why are people showing up? I'd look at our 100 employees and think at any given day, by the end of the day, they could be employed somewhere else and perhaps making more money, or most likely making more money. But what would make them want to stay? And the thing that I feel like I learned from Brad Wilson, our former CEO at Blue Cross of North Carolina, and continues to grow in terms of my own leadership and what employees need, and that is this notion of psychological safety in their organization. And for me, it's so much more than just trust. So I would just say that 10 years ago or 15 years ago, this whole like, how do you build your trust quotient within your organization and how important that is.
Mm-hmm.
And that is important. I think psychological safety is an idea that's even bigger, and it's so individualized, and people need to know that they can show up at work in an authentic way, that they can have a voice, that they can have perspective, that they are seeking transparency and communication, that they need and deserve flexibility. And I think we're really working. So we feel like that's a journey.
Yeah.
Like we haven't figured it out, but we're committed to it. And I think employees more and more every day in our organization believe in our commitments to better communication, anything we can do to support the health and well-being of our own employees, understanding, I didn't touch on this one yet, this is critical, having a vision for your organization is so important.
Yeah.
And employees need to hear about it a lot. Like saying it once or saying it 10 times is nowhere near enough. They have to hear constantly about what is the North Star, how do we get there, and then how do they bring their understanding of their work and then the autonomy of their work, the purposefulness of their work, and bring us there.
Yeah.
And so we are just constantly working on this. And I think we're at a really good place where employees recognize like we're committed to this healthy environment, we're committed to better communications, and we're committed to having high expectations for our own performance.
Yeah.
So that we're making a difference for the children that we're there to serve.
That's incredible. And it's really inspiring to hear you talk about that particular aspect, because I think with all of us who are in organizations, our goal is that people who are involved with or work in the organization really understand the vision, where we are today, where we want to be, and the roadmap on how we're going to get there. And the importance of people understanding how they contribute to making the journey cannot be overstated. It's really, really important for people to understand that, because the more that they understand how they can help, not only do they feel like I'm coming to work with this thing that I'm doing that's going to help this organization, but it also helps to make sure they're aligned with where they want to be too, right?
Absolutely. Yes.
You've done some amazing work, but you've also done some pretty amazing things outside of work too. So we joked before we started about when I'm going to sit down with someone, one of the things I want to know is I kind of want to understand, tell me a little bit about what you're doing. Tell me a little bit about some of the things that you've been involved in. Have you gotten any awards? Have you been this or that? And when I saw all of the things that you've been involved in, coupled with all the things that you've been awarded in, I thought, oh no, I don't know that I'm prepared for this, right? So what I'm going to ask you about this, and there's one thing we definitely have to talk about before we go, but I'm going to save that one. In all of the work that you do on various boards and on committees and helping to set direction, how do you balance doing those things with the work that you do every day with your own organization?
I got you. So I guess you just do it, That's a good quote. One of the things you asked in your intake questionnaire was, you're almost the strength finder question. Like,
Yeah.
how are you identified, by other people, and the maximizer and the leverage and the relationships. And I would say, humor, not in joke telling, but really like bringing wit and humor and levity to my job and the people I'm working with is just always been really important. And so, and I think I'm really fueled by this need to solve problems.
Yeah.
And so one idea is like, do you love the problems that you're solving, because that's
Oh.
what work is.
Oh,
Like, so
wow.
how
Okay.
do you find work that you really love doing? And then being with people. And so I think that's it's sort of the fuel for creative thinking, brainstorming, ideating, and figuring out how do we make a difference. And then it's allowing the beautiful, smart, talented people around you to like go for it and make it theirs. I know I was taught by one mentor, long ago, like you have to also learn as a leader. I think it's an old saying that to almost have holes in your tongue is what the saying is.
Okay.
And the notion is, once as a leader you all agree on whatever the direction is or what is the end result that people are looking for, allow folks to go and achieve it based on their expertise, their creativity, their specialness, not just your ideas.
Yeah.
And that is that whole concept of the autonomy, and people crave that.
Yeah.
And so cheering for your folks that are applying their ideas to the vision is what I think is one of the most rewarding parts of leadership.
You once walked across the state of North Carolina, and we literally mean this, right? Like you
Yes.
walked,
Yeah.
and you were expecting twins.
I was pregnant with twins. Yep.
Can you tell me? Give me some
why?
background. Like, what happened?
Yeah,
like,
exactly.
How did that happen?
So, yes, I'll tell that story. So, I'd always wanted to walk across the state of North Carolina. So, for whatever, remember, I think I was born here in a former life.
That's right.
I arrive here. I am employed here. And I just always thought, and I'd biked across North Carolina with state games of North Carolina, but I always wanted to walk. So register that.
But it's a big state.
It's a big state. It's a very long state. Yeah, it really is. It's not Rhode Island.
No.
So, and I've walked across England. I've walked across France. I've walked, but I was also privately trying to get pregnant, and I wasn't sharing that publicly with anyone, so no one would know that. They wouldn't know it. I happened to be walking down the hall at the time that one of my executives was coming out of a board meeting where this idea of we need to have a campaign around health and walking and self-responsibility and one step in front of the other, and everyone can do this, and how to embrace just personal health changes in a real easy way. And so I'm walking down the hall. All of a sudden, he's walking down the hall, and he said, "I need someone to walk across the stage." I said, "I'll do it." Like that. And he goes, "Great. You're doing it, Higgins." And so I walked into the women's restroom. He walks into the men's. And I get in there and I think, oh, no, that's right. I'm pregnant. Well, I'll figure that out. So the beauty of this was, and I didn't tell anyone, the beauty of this is that, and it was a corporate investment in community and promotion, and it was a campaign. It had all the elements of a marketing campaign focused on health, and it was going to launch April 1st in Asheville. So it wasn't Murphy to Manteo. It wasn't sort of a straight line, and It wasn't the Mountains to Sea Trail, but we basically walked from Asheville to Wilmington, but we were all over the state. We were down in Charlotte. We walked up to Winston-Salem. We walked to Greenville. Then we were over in Goldsboro and Fayetteville. And then we were back out in the Sampson County and then beyond. But we finished 72 days later, 650 miles. And my role was as a messenger, it wasn't, the Kathy Higgins walk across the state of North Carolina while pregnant with twins. That was I still kept that confidential. The beauty of it on a personal level was it turned out like April 1st was the start of my second trimester. So the 12 weeks that you have the best chance of feeling good, I was when this walk took place.
Was the walk-in time.
And if you think about at any given time, wherever I was in the state, I could, like on a Friday, we'd walk like 20 miles in the morning, and then I could drive home and have a doctor's appointment to get checked out like every other week, basically.
Yeah.
With my OB-GYN and my high-risk doctor. So I had my medical team, just my normal medical team, for being pregnant with twins. But again, that wasn't the story.
Yeah.
The story was about promoting walking, self-responsibility, you can do it kind of thing, and little steps lead to big changes. And so when we got to Wilmington and, there were thousands of people on Front Street, the waterfront there, and police escort and fire engine escort, and, the whole festival was taking place. And my CEO at the time, he got up to the mic and said, "Can I tell them?" And I was like, "Sure, go ahead." So that was the point. Like, my personal health was not on the forefront. It was the background.
That's amazing. That's amazing.
Yeah.
I wanted you to tell that story because I think it really tells a lot about who you are as a person and all the work that you've done. Because to think about walking across the state and not telling anybody at all that, hey, this is not about me, it's about the cause. And then to hear you talk about your work at Blue Cross and then your work today and how you think about running the organization, what it is that you want to draw from people, even the time that you spend talking with the individuals at schools and how you think about the organization's work with the schools. It all fits together and really says a lot about who you are as an individual.
Thank you, Artis.
And really why I wanted you to come and have a conversation with us
today. Thank you.
So it has been phenomenal. I feel like, though, there's probably a part 2 out there somewhere that we're going to talk about because, we didn't talk about your athletic Hall of Fame stuff.
Yeah.
And you mentioned coaching. And so there's some other things in there that we are going to have to touch on. And it will be really cool to hear also updates on how your organization is continuing to grow and progress too. So
thank you.
I'm going to make the commitment that we're going to have you back as long as you're willing to come back.
I would love that. Yeah.
If you've enjoyed listening to Kathy and our conversation, then please tell somebody else. It's great to have someone else be able to hear the conversation and enjoy it as well. Make sure that you subscribe so that you know when we have new episodes. And thank you for all the things that you do out there to be remarkable. And so until next time, stay remarkable.